In terms of the opiate crisis, I've never seen anything like this.
I called him numerous times, left messages. He didn't answer. As a parent, knowing that he was addicted to heroin, I was thinking the worst.
If you do drugs, it can destroy your system.
People are dying after a fairly limited number of opportunities to use heroin that's laced with fentanyl.
I remember him saying this is the only time you're shooting up, and I remember thinking that was amazing. I want to do that again.
There's not hardly a day that goes by that somewhere in the North Country somebody hasn't died or become seriously ill over a result of this epidemic.
I started drinking at probably 9 or 10 years old. When I went from powder cocaine to crack cocaine, the high was so much more instantaneous, but so much shorter lived that I had to get high so many more times in order to have it last.
On a scale of 1 to 10, I would estimate it's probably at a 7.5 or 8. It's crossing all boundaries.
The impact of this epidemic is staggering.
I was like a yes girl. Sure, yeah, that sounds good.
It tore my family apart. I don't see my mom anymore, or my little brother anymore. And I live with my dad full time, and I don't have a mom in my life.
I still remember looking at the young man, the froth covering his face. What a waste of human life, you know, to die that way.
It pretty much ruined my family. My mom went to prison, my dad went to prison because they were selling and using it.
I snorted it the first time. I had 2 children, needed to support them, needed to support my boyfriend's drug habit, which very soon became mine. I went and I bought 5 bags. My boyfriend, I told him to get mine ready while I was, getting the kids ready, and came back and I asked him where mine was, and I was very persistent. I just spent like $100, and he showed me a needle and there was stuff in it, and he said this was all that was left. I kind of just said, screw it, fine, I'll do it. That was the day that I opened doors that I couldn't close for a very long time.
I think, first of all, you have to admit there's a problem. Now that we've identified there's a problem, we need to provide those resources. I think it has to be a collaborative effort. There's no one magic solution that's going to fix this. We've seen it right here in Clinton County with the SPARCC Coalition, getting law enforcement together, along with medical professionals, interested members of the community, families of people that have fallen under this addiction and people that have been in this cycle, and people that are in recovery right now. And I do believe it's doing a lot of good.
The SPARCC mission is to attack this from all of the different angles, not just from prevention, not just from treatment, not just from recovery, not just from law enforcement. We've formed a coalition of people that represent as many segments of society as we could get, and we're always looking for more people to be involved.
Tremendous passion and energy, both from our state licensing agency, as well as from a coalition like SPARCC, in terms of prevention is, one of our very first initiatives.
Prevention comes from multifaceted teams such as SPARCC and ECHO, and we're trying to develop programs where we can get early intervention and try to get education programs, not just with kids, because we see the opioid epidemic it doesn't discriminate.
I really liked Deirdre because it taught me about drugs and what some of them can do to you. It was really fun being able to have a real police officer right there, and they were loud and clear so that we could hear them and actually understand what the meaning of drugs were.
The biggest benefit from the DARE program was that you can do it if you want to, but you shouldn't, because it's going to end up either taking you away from your family and then might never be able to see him again.
I haven't seen my dad throughout my whole life. I mean, there are times where he's popped in and out, and he's tried getting better, but then he's relapsed, and every time he comes back it just gets worse and worse for my family.
I think the effect of the epidemic is impacting a lot of families. I think a lot of families are being separated. I think the increased number of students placed in foster care is not only impacting just the kids, but it's impacting other families who are having to take kids in.
I think it really sets home how controlling, you know, these drugs can be. What would it take for somebody to come to your house and say, okay, I'm taking your child, and for you to say, yeah, I'm okay with that?
I used to be in foster care, and I was young, so I didn't really understand why I was in there. And I remember, like, it was just heartbreaking because I always just wanted to go home and I couldn't. So I just didn't understand. I thought it was my fault, so I used to blame myself a lot. It was kind of like you just put all the blame on you.
If I was a parent, I'd openly communicate with my kids, make it easy to talk to.
Yeah, I don't think I want kids because I don't want to fall into the same mistakes that my parents made.
Kayla, I'm not joking. I did 4 pregnancy tests on you, and you are pregnant. I didn't know what to think at first. It kind of really hit me hard, and that's when I decided that I can't put another man in front of my child, and I can never put drugs in front of my child again, that I had to change. And if I did change, and I showed the judge and the courts that, look, I stayed clean for my baby and me, that maybe I'd get my other children back too.
Heroin, for instance, sells for $35 to $40 a bag here in Clinton County. That same bag will be sold in New York City for $5.
Drugs are really easy to find around here because everywhere you go, like, everywhere. There's no place where you can't get drugs.
I mean, everywhere you go, you end up knowing somebody that either knows where to get drugs or has drugs.
There's like not a spot you can go in Plattsburgh that doesn't sell drugs.
You can't walk down the street without seeing a needle on the ground.
The individuals who are coming into the community that are bringing the heroin, that are bringing the cocaine, the crack cocaine into our community on a regular basis, those are the people that law enforcement in my office primarily focus on prosecuting. Local addicts, those are the people we try to filter through the system through our drug courts and our diversion programs.
What we clearly have been doing for decades now is the same thing, arresting people and then putting them away. Unfortunately, the drug trafficking industry has involved more and more people over the years, so therefore law enforcement are more and more involved and busier. So when you start dealing with upwards of 100 cases a year, you don't have an awful lot of time for care, compassion, and outcomes. It's just, let's move on to the next case. Here's another dealer, here's another overdose, here's another trafficker coming in, and you just constantly end up chasing that tail over and over to do more arrests, get more of it off the street. Well, it's great to get more of it off the street, but we haven't done anything with the desired, and we haven't done anything with treating these people.
It's also been really helpful to have an ever-enlightened understanding of addiction by the criminal justice community as well. The police and other criminal justice agencies, the drug courts have led to an understanding that people who are caught up in the criminal justice system because of their addiction really need an alternative to incarceration to get access to treatment.
We're waking up to the problem. Instead of putting a lot of money into an incarceration facility and locking people up, we're seeing a lot more money getting on the front end. For instance, at Franklin County Jail, people come to jail. We have folks from Citizens Advocates. We have folks from St. Joe's treatment for whether it's a substance abuse issue or a mental health issue. When you become an inmate, you're going to talk to. You're going to have an opportunity to sit down and talk to. And if we can steer you into a program, get you involved in a program, and you want to be rehabilitated, you want to get better, then those opportunities are there.
I mean, you can put them in jail all you want, but you got to give them more.
Because they're just going to get out and do the same things over and over again.
I think the primary value of SPARCC to our local community, Essex County, Franklin County as well, is awareness. Making people aware of the problems and the issues. Through SPARCC, we've been able to bring in a number of nationally known speakers to the community.
When I got sober, I felt like everybody needed to recognize I'm sober, I'm a different man, I'm moving in the right direction, I'm somebody now. I wanted results quick. All those years, 15 years, you screwed up and made poor choices and destroyed your life and destroyed the lives around you, and you expect everybody to forgive you and your life's going to be better overnight? That's how I felt. That's what I thought. The most important piece for me was finding acceptance for what I'd done and understanding that I needed to be very, very patient in the process.
Addiction is a brain disease. There's a lot of understanding that trauma in an earlier point in one's life can lead to addiction. So we're becoming much more of a trauma-informed treatment community.
Treatment is the answer, and so if we can get the person to agree to see a professional, to talk with somebody in treatment, is where our power is in helping others.
Studies show that any county that has a syringe exchange, the incidence of HIV and Hep C dramatically reduce. When you apply for a syringe exchange grant, you have to get community support. Another outcome of a syringe exchange is that we save lives through Narcan distribution and training. It also helps get people into treatment, which is a very big bonus.
I feel like every home should consider stocking naloxone in their first aid kit. You just don't know what somebody's going to be exposed to nowadays.
I was somebody that firmly believed this could not happen to me, this could not happen to my family. We were better than that. I was a single father for many years, raising my 2 sons the best way I knew how. I enrolled them in St. Peter's, and then they moved over to Seton. In 2012, he ended up cutting his fingers by doing something that he loved, and that was cooking. He almost cut them off. So that meant a trip to CVPH, then over to Boston, and then we had many more trips to Boston. Of course, there was a lot of pain, so he was taking meds at that time. And I don't know if that was the cause of his downward spiral or not, but at that time, I started to notice a little bit different with him. I later learned he became a master of disguise. And what I mean by that is that he covered up things quite well, even though we were so close. I knew that he was using, or had a pretty good idea. I can't say I knew, I couldn't prove it, but I had a pretty good idea. So we had to talk daily. He had to listen to me daily. I, for lack of better words, pissed him off on a daily basis, talking to him about it. But it was important for me to get him help. But he wasn't ready, I guess. On a Friday night, I texted him numerous times. He didn't answer. I called him numerous times, left messages. He didn't answer. As a parent, knowing that he was addicted to heroin, I was thinking the worst. Sunday morning, he called me. I OD'd Friday night, Dad. I died. I'm really scared. I want help. Tried. It takes a while. Unfortunately, it's not something that happens real quick. I wasn't able to find him a place before he decided he didn't need help again, because that window of opportunity is very short. So unfortunately, he thought he had it beat. Well, as we know, he didn't have it beat. On February 18th, I dropped him off at the addiction center so he could go to his counseling meeting. I had arranged for his girlfriend to pick him up. I got a text from his girlfriend that said, "I'm here," and Kyle's not. I said, well, why don't you wait a little bit? He was having a hard time. Maybe he's taking a little bit longer with the counselor. She waited. She waited for an hour and texted me back and said, "There's nobody here." I went to the doors are locked. So I'm thinking the worst. I'm texting Kyle left and right. Finally, he didn't have a good phone. Finally, I do get a text that says, "I'm okay, Dad. This phone sucks. It wasn't charged. Love you." Well, that was the last text I ever got. I drove home. Had no clue where my son was. Wasn't answering the phone. Walked in, told my wife that, and up pops a message in Messenger that said, "Please call. Something happened to Kyle." I called that number. A lady on the other end, a woman on the other end, answers the phone and said, "Kyle OD'd. They're taking him to CVPH." My wife and I headed down to the hospital to see what was happening. But on that way, I had a feeling that it wasn't good. So I had to call his mom that lived in Oklahoma. I had to call his brother that lived in Oklahoma and tell him they better come back. Then I went in to see my son. He was on life support. They did what they could at CVPH, and they decided that they were going to take him to Burlington. There was nothing else they could do here. We stayed with them through the night. In the early morning hours, they transported him to Burlington, My wife and I followed. When we got there, they brought in a team of doctors that do assessments on brain swelling and that to see if there was any response. They said, once we do this test, depending upon the outcome, we'll have to declare him deceased. Well, I kind of wanted him to, even though I thought he was deceased last night when I saw him, I still wanted him to be there for when his mom and brother arrived. But they had to do the test. They did the test, and they come out and said, I'm sorry, your son is deceased. I look out at concerned citizens. I looked out at loved ones, healthcare providers, law enforcement. We are on the right path. We still got a long way to go. What might have started out as a choice eventually becomes a disease. Finding more help, opening more treating facilities, speeding up the process, and probably the big one is reversing that stigma is a good start. All of you in this room are here, and you guys are the pioneers in this quest. So I ask, could I have done more? Only the good Lord knows. But personally, I'm on a mission to help all in any way I can. I know I'm not going to save everybody, but if I can make a difference in one person's life so that family does not have to go through the pain that I have, I'll consider it mission accomplished.
At Champlain Valley Family Center, because we've been an outpatient provider, when somebody is coming in and really needing that detox service, what you want to do is to be able to help them when they're asking for it. And it's been very frustrating as a provider to not be able to do that every time that somebody comes in because of the lack of access.
Champlain Valley Family Center is opening an 18-bed residential facility. We'll be treating people with substance use disorder who are in moderate to mild withdrawal from any substance of abuse. So we'll have a rehabilitation center there as well, and it fills a huge void for this county. These 18 beds in Clinton County will surely save lives and are desperately needed.
My son, he needs prayers and needs strength. 2 weeks ago, he was pulled over and was arrested again for DWI, possession of marijuana. And it's the hardest decision as a parent because there's this line between enabling and supporting. And we're essentially, you get to the pleading mode, like, what are you doing? It's only gonna be a matter of time. You're gonna be in jail, you're gonna be dead. Those are the conversations I have with my son all summer long. And thank God he's in jail. Thank God he's in jail. And we did not bail him out. And he's going through this process, and we're visiting him and supporting him. And I'm not embarrassed to share this because there's that stigma that we keep talking about, and I'm guilty of it.
Stigma is a big part of this, and I think we're making gains in that, but certainly anyone that wants to seek treatment for this awful addiction and for substance use should not be stigmatized.
I'd take out words like clean and dirty. I would take out words like junkie and drunk.
I don't like the word addict. I think addict, it provides its own stigma to the addiction. I think addiction is a word that is okay to use. Substance use disorder is more preferable.
The stigma reduction, I don't think it's a question of a word here or a word there. I think it's an attitude, it's a receptivity, it's an openness to recognize that we can be generous to those individuals in our community who need our help, and I think that we're making some progress, but still have a long way to go.
These are your neighbors, these are your friends, these are your relatives, these are your brothers, your sisters, your cousins. I mean, these aren't disposable people. People have made bad choices. They've suffered as a result of those choices, and now they're trying to make better choices. They're trying to make better decisions, and we need to help them.
Referencing that addiction is really a moral issue, and it's a shortcoming of willpower. And that's not the case either. An individual in recovery, an individual in the recovering community, those kinds of words really speak to the strength that somebody has to really battle with their addiction.
I don't want to glamorize addiction. But what we're trying to do is remove the stigma from recovery.
So it's important that law enforcement thoroughly understand the impact of stigmatizing somebody and how we can be the first level of change for these people right at the point of arrest.
Stigma? I think stigma is probably the single biggest piece of this that we have to try to eradicate. I had a supportive family when I went into recovery. I had people that were in my corner, but I still felt really bad about myself. I felt like I was this moral defect, this person who'd made all of these bad choices because it's what I wanted. And what I learned about this and having an illness is, although some of it is choice-driven, certainly, I have an illness that's not dissimilar from diabetes or cancer or any of these other things, and it is terminal and it is fatal. And the stigma piece comes, if you liken a cancer patient who has 6 relapses in cancer, nobody ever looks at that person and thinks anything bad of them. They just had 6 relapses and that's too bad. When you think about an addict, by the 6th relapse, most people are going, he continues to make this choice and go down this path. And that's the piece of the stigma that we have to eradicate. It's not a choice. It's we are addicted and we will do anything to do that until we've made the changes in our life to not have that be prevalent.
Whether it's food or exercise or alcohol or heroin or opiates, it's all the same stuff. The reasons why we do all of those things in extreme comes from the same routed issue. And for me, it was a huge void. It was this void within myself that I don't fit in. I'm not good enough. I was like a yes girl. Sure, yeah, that sounds good. Tried to like put a good front on that I don't care what you think about me, but deep down, like I really do. And I'm really this young, insecure girl who doesn't fit in right now. And if you look at a teenager, that's exactly where you're supposed to be. You know, you're supposed to be this insecure teenager, but a lot of teenagers accept that. They deal with life like correctly and they go through that awkward stage and then they move on. I dealt with life and I dealt with all those insecurities and emotions by drinking and by doing these things, and that's where that behavior started for me. A lot of people were growing up, you know, doing all the things that you do. I stayed the same. There's a lot of crazy drugs out there right now, and I'm blessed that I was not using when all of these things have been created, because I would have said yes, and I'd probably be dead right now. But at that time where I was, it was marijuana, it was some booze, and maybe a little bit of E. All of the really, really hard stuff wasn't in my town yet. That's a blessing. I had warning signs in high school. I was court-ordered to go to a 12-step program. I stayed sober for a couple months, and then I just, you know, thought I was better, thought I was fixed. So I can have one. So I started to drink, you know, a beer or two, just socially. Like, I'm about to graduate from high school. I'm not drinking, are you kidding me? I'm way too young. So all of my focus and thoughts went towards, where am I going to go to college? I'm getting out of here. This small town, I'm so much better than this. This is stupid, and I'm going to go into the real world, and I'm going to prove to everyone that I have what it takes, and I'm good enough. I moved down to New York City, and that's when things started to get a little bit out of hand for me. I found my crowd of people down there. I did, and we partied, and we went to bars, and we hung out, and it was all drinking at that point still for me. There was no drugs involved, but cocaine came into the picture. I went to school at a fashion school, so there was a lot of cocaine. I had about 7 to 8 months in college. My grades when I hit my rock bottom were still a 3.5 because I would take Adderall and I'd go to the library for 12 hours and study for these tests right before them. No one would have known that I was hitting rock bottom because I was still doing all the things that in society y'all tell me to do. I had no vision of anything. I lost my soul. I had come upstate from my girlfriend's funeral. Here she was, this really bright, awesome person who had died. And here I was, I didn't even want to go to her funeral. I was so consumed within myself. I only thought about how I was feeling at that time, nothing else. And how I looked, and I was all puffy, and I was not pretty at all. And I didn't want my whole entire class to see me this way. So I didn't want to go to her funeral. I remember one of my girlfriends came to my house and said, "Get your ass upstairs and get dressed. This isn't about you." And I went to her funeral. I cried the entire time. And then I was about to get on a train to go back to New York City, and I had this thought, and it was the first time I think I've ever felt like I had a choice. If you go back down to the city, you're going to be alone, and you know exactly where the liquor stores are. Get off Penn Station and go to this one, and you're just going to start drinking again, and you're probably going to die. And the other thought I remember was go into rehab. I went into a 28-day treatment, and that's when I physically stopped everything. I have no idea why I was chosen or why I'm here, and so many people that I've met aren't here anymore. They're dead. I can't take myself super serious because then the rigidity of life is just like not why I got sober. I got sober to be free. The disease itself has chains on you from day one. It's just the way that it is. And essentially what we find out is that we're the ones that are the chains. We're the ones that have created the chains that are put onto ourselves. It's not society, it's not that person over there. At the end of the day, the alcoholic and drug addict finds out they're the problem. I'm the problem. There's a recovery community that is a bunch of loving people that literally give up their entire time to help another individual. They've been my support. Part of recovery and the whole concept of getting sober, not doing drugs and drinking anymore, I mean, it's completely possible. There's miracles everywhere, but there's also a lot of people that are dying from this disease. So, you know, just because you stop drugging and drinking, that's 5% of it. Then there's like the real work that really, really, really is what gets people from having 4 months of sobriety and not drinking or drugging to people you'll talk to that haven't had a drink or a drug in years. I fixed alcoholism, I'm better now. No, it's not how it works. This is a lifelong process for me of self-growth. I continued to use the tools that were given to me by many different places. I have my own toolbox, and we all have our own toolboxes. Once you make the decision to stop drinking or drugging, you've automatically opened up that toolbox. You start adding the tools, you know, this, till finally you get some time and you're doing the work and you've got this great array of tools to work with. I felt like in high school and my whole life, I was never given that toolbox. Not because of my parents, not because of the school I went to or where I grew up, because I'm an alcoholic and because I just didn't understand that, you know, you get those tools when you emotionally deal with something.
I work with a woman, her name is Fran, and her son overdosed a few years ago. And I watched how this woman and her family suffered as a result of that overdose. A young, bright man just no longer there. But I've watched this woman in terms of what she's done in the community, in terms of inspiring and giving hope. And actually, I hired her at Champlain Valley Family Center to work in our program as a peer advocate, as a recovery coach, and she's doing some amazing things, both in her work at Champlain Valley Family Center and then personally in the community.
College, get a job, start my own life, be different than my parents.
Either a CO, a police officer, border patrol. I don't do drugs. So drugs won't really affect my future.
I want to be either a psychologist or a chef because I really love cooking, but I also really love helping people, but who knows. I do have a dream to be involved in medicine, which helps me navigate through the drugs and stuff like that and go on my own path.
I've had family members that have struggled with addiction. I've had family members that have survived from addiction. So I've seen both ends of it. And, you know, there's always hope out there. And I want to make sure we keep sending that message is there is hope.
The entire community working together, I think, is the best hope for the future and has already shown some really nice progress.
We're doing a lot more education in schools, trying to keep kids away from this stuff to begin with. We're doing a lot of work with doctors and pharmacies about prescription medication, which is where a lot of this stuff starts.
Beyond teaching kids, I think the education of the private sector, understanding that a person who is struggling with addiction and they're working on getting clean still needs to have employment.
What we have come from and our past experience does not have to define our future story.
Celebrate recovery.
What's giving me hope right now is sitting down and dealing with people like the United Way, dealing with Rochelle Gregory, dealing with the Michael Carpenters of the world that finally have risen up together, not independently at different times, but together to say, if we hold hands and we work together, we can surround this and we can make a difference and we can win.
I had a dad that was alcohol dependent. And with time, that just worsened and worsened and worsened until ultimately my dad committed suicide. And growing up in that kind of a family, I was absolutely committed that I was not ever going to be like him. I was not going to drink. And, you know, good thought. And I didn't until I was around 18 and a half, at which point I started drinking alcoholically. I used some substance. I could have easily been diagnosed alcohol dependent, and it wasn't until I was 31 that I got help. I've always kept that part of myself rather private. And a few minutes ago, I mentioned to you Fran, and annually she holds an event over at the hospital. It's called A Light of Hope, and it's usually outside on the grounds at CVPH. I have been inspired especially over the last couple of years, by people who've had the courage to kind of come out and say that they're in recovery. I had always protected my recovery. And quite frankly, it was the fear of being judged. And I realized what a disservice my fear was in terms of helping me advocate, inspire, offer hope.
This organization has the ability to do great things because we have a grassroots movement going on. And at that grassroots movement, there is no ego. None of us are looking for anything other than to help eradicate this problem. And I think the things that we've done in a relatively short period of time point to that. By nature, I'm a pessimist, so guardedly optimistic is probably pretty high for me.
The Adirondack region is the greatest place on the face of the earth. We measure this greatness based on the level of empathy that we have for each other, the ability to work together, form partnerships, form coalitions, cross boundaries in order to make a difference in our region. When it comes to the heroin and opioid epidemic and other issues related to addiction, we have only just begun this journey to address these issues. They're very challenging issues, but no people and no place are better qualified to handle these challenges than we are here in the Adirondack region, because we are addicted to hope.